We're going to be one of the key centres for doing COVID PCR tests. We'll be able to do over 200,000 PCR tests per day. We're in the process of expanding to our full size, which should be done before the end of the year. So our lab's slightly different to a lot of the other labs that you see doing PCR testing. Most other labs do quantitative PCR or qPCR. We actually do endpoint PCR, ePCR. There's a subtle difference in the way the two things work, but the real critical difference is our technology allows us to run at a much higher capacity, so we can do many more tests, A, for the same footprint of a building, but also at a cheaper price point. So one of the critical things that we can do is our normal assay just says, do I have COVID or not? But actually there are other assays that we can do on the same system to say, do I know what type of variant I have? We can test a sample to say, is it COVID or not? And then we have a range of other tests that we can then run to say, is it a common variant? So is it the Delta variant, for example? And that allows us very quickly to say, is this a sample that's really important? And if it is, we can then put it in for genomic sequencing. That process end to end takes about 48 hours. In the medium to long term, we'll also be able to use this facility for doing other things associated with COVID, such as genetic sequencing of the virus to identify new variants.